Medicine as Governance.
In order to understand Korean medicine in the 1960s, it's important to review political and social context of the time. As the ideological conflict over medical policy in the 1950s demonstrated, modern Korean medicine had a close relationship with politics. The geopolitical backdrop of the Cold War played a crucial role in the 1950s and beyond. North and South Korea were locked in an ideological confrontation, and as a frontline of the Cold War, South Korea received intensive aid from the United States and the West, and on the one hand, this enabled the country to rebuild rapidly after the war. Politics was also an important backdrop, as medicine was closely linked to social stabilization. After liberation, Korea experienced continuous political upheaval. The political regime that came to power in the post-liberation period gained power through election fraud, military coup, and other illegitimate means, which meant that those came into power had fragile political legitimacy. In order to gain legitimacy, the new regime had to emphasize that they were different from the previous regimes. Health and welfare were mobilized to do this, and because of this, changes in Korean medicine have been closely linked to political power shift. Here, we will look at the development of Korean medicine in the context of geopolitical changes in the 1960s. The Park Chung-hee regime, which came to power in a military coup in 1961, was characterized as an authoritarian developmental dictatorship, and mass mobilization, which was one of the hallmarks of authoritarian governments, characterized medicine of this period. Nationwide, top-down health initiative based on mass mobilization were, on the one hand, successful in quickly addressing immediate problems such as epidemics. But as in the colonial period, they also violate people's rights. In addition, the will of the state among the three main pillars of the medicine, patients, healthcare workers, and the state, was largely reflected, and the voices of the patients and healthcare workers were ignored. This unilateral policymaking has since become a major source of conflict between these three main actors. It was also a period of intensifying debate and conflict over healthcare in response to the expansion of medical interventions. It is significant because a large portion of the prototypes of current Korean healthcare can be found in this period.
Rise of birth control.
In Korea, where fertility was traditionally considered a virtue, birth control began to emerge in the 1920s. Following the adoption of Western eugenics and birth control in the 1920s and 1930s, ideas of birth control emerged in Korea, centered on concepts such as economic poverty alleviations, eugenics, and maternal health. However, with the entry of Japan into wartime in 1938, the emphasis was placed on population growth rather than birth control. The focus on population growth continued into the 1950s following the Korean War. After liberation, Lee Seung-man regime continued to reward fertile women, and fertility was seen as a social virtue. The main reason for this was to ensure military strength. With the North and South divided and at war, It was thought that if the young population was reduced through birth control, there would be a major crisis. Furthermore, it was thought that if the country were to be reunified and election were held, the South would have to have a larger population to win the election. As a result, in the 1950s, the South Korean government actively sought to increase the population. Immediately after the war, the population growth rate began to soar as families were reunited and children were born. The peak of fertility was in 1955. Because of the reunification of post-war couples, and in 1959, due to the generation of post-war marriages, the so-called baby boomers. One peculiarity is that while most other countries in the world experienced a population boom immediately after the end of World War II, Korea experienced it about a decade later, with the population exploding after the Korean War. In the private sector, the birth control movement was initiated in the 1950s by academics who had returned from studying public health, demography, and sociology in the United States, many of whom had studied with the funding of the Rockefeller Foundation. US-trained Korean doctors became the primary mediators of international population control networks into Korea and effectively ran the country's family planning programs after they became national agenda. The population specialists formed through early study abroad in the United States provided the intellectual basis for the later family planning programs. Through private foundations, such as the Rockefeller Foundation, the US government was keeping a close eye on Korea's population dynamics as issues of population, and hence, birth control was deemed inappropriate to directly intervene as it was closely linked to the governance of the country. The Western world regarded population explosions as a major impediment to economic development in the Third World and a global security concern because of the potential spread of communism, which can happen if economic poverty increased. However, direct involvement of the US in population issues in the Third World could be seen as interference in internal affairs. So they used private organizations such as the Population Council, the Pathfinder Foundation, and the Ford Foundation. Population Council, which was funded by the Rockefeller Foundation, had a profound influence on the shaping of family planning in South Korea, and even composed its sole office with resident staff.
Economic development and population.
Then, in 1961, a military coup brought Park Chung-hee into power. And the issue of population control came to the forefront of national policy. It's interesting to note that while population control was essentially the domain of health and sociology in South Korea, it was implemented as an economic policy. The military government of Park Chung-hee paid a lot of attention to economic policy in order to secure the legitimacy of their regime, because one of the rationales for their coup was an economic failure of the previous Lee Seung-man regime. So Park Chung-hee's regime launched a 5-year plan for economic development, and population control or family planning became a part of that. It was the doctors who turned a health problem into an economic problem. Obstetricians, gynecologists, and preventive medicine doctors argued that if they aggressively reduced the birth rate, they could reduce the amount of childcare cost for the under 18 population, the non-labor force. and then reinvest that money in industrialization, which would lead to the development of Korean economy. Furthermore, if the overall population growth was curbed, this would increase the per capita national income. Park Chung-hee's government embraced this idea and promoted family planning as a part of its economic development plan. In 1961, family planning became a national program and made South Korea the third country in the world to adopt population control as a national policy after India and Pakistan. One of the first family planning surveys to be undertaken as a national program was carried out by the Population Council, which was an affiliate to the Rockefeller Foundation. Beginning in November 1962, American researchers traveled to Korea to conduct surveys and make policy recommendations. In addition to training personnel and advising on policy, international population organizations and governments from around the Western world provided support to the Korea's family planning program. While family planning was seen as a means of economic growth and the country modernization by controlling population growth, it also served as a conduit for foreign aid and support for development. In 1964, domestic production of condoms and contraceptive jelly began, and intrauterine devices began to be administered. The domestic production of contraceptive devices was also supported by the Population Council under the supervision of the Rockefeller Foundation. And the patenting of contraceptive devices such as Lippes loop was resolved through the US organizations. In 1967, oral contraceptives began to be supplied through the Swedish International Development Agency. The Mothers Club mentioned earlier was the organization created to distribute pills throughout the country. By the late 1960s, Korea had gained an international reputation as a leading success story in family planning. And the official US government aid money began to flow in. With the influx of capital, the organization expanded its mobile clinics, which set up pilot research centers, and conducted extensive retraining of existing outreach workers. While aid has played a crucial role in Korea's family planning program, medicine has also played a key role. Not only has family planning been incorporated into economic development plans, but the involvement of medical personnel has been essential to the entire program. The intrauterine device, oral contraceptives, and later tubal ligation, which were all main tools in Korea's family planning program, were only made possible through medical personnel. During this period, medical personnel actively participated in state-led programs and gained social status and economic benefits. Also, a distinctive feature of Korea's family planning program was that the government set annual targets and enforced their achievement from the top down. For example, if the government directed that 300,000 intrauterine devices be inserted annually, local health centers and their family planning workers would go door to door to encourage the use of intrauterine devices and perform the procedures. Women of childbearing age in each household were required to have their contraceptive status regularly checked by health centers or Mothers Club. These intensive programs were carried out with the aid and technical support of international organizations. At the same time, Korea became a testing ground for newly emerging contraceptive technologies and population control techniques. Nationwide mobilization led to the formation of more than 700,000 family planning Mothers Club and the deployment of family planning workers at the town, village, and the district levels across the country, all of which were monitored and data collected by US aid agencies.